Today, I want to connect two things that most people think of separately: your posture and your nervous system function. Because it turns out they are far more intimately linked than most people realize. First, rethink what posture actually is. Most of us grew up hearing stand up straight or sit up straight as a cosmetic instruction, something about looking confident or professional. But posture is actually a neurological phenomenon. Your posture is the physical expression of your nervous system's current state. So here's what I mean. There's a fascinating body of research, some of it coming out of neuroscience labs and some of it coming from chiropractic and rehabilitation science, showing that postural changes produce measurable changes in our nervous system activity. A study out of Auckland showed that sitting in an upright posture reduced self-reported fatigue, improved mood, and increased self-confidence compared to sitting in a slumped posture. These subjects were actually people who were being treated for depression. So the research showed that their physical posture was influencing their brain chemistry. You can change your mood by just changing your posture. How cool is that? On the flip side, chronic poor posture, that forward head position that we see on almost every x-ray these days, puts your nervous system into a low-grade stress response. So think about the posture of fear or grief. Your shoulders are forward, your head is down, your chest is collapsed. Now look at the posture of someone sitting at their desk staring at their screen for 8 hours. It's almost identical. Your nervous system doesn't know the difference between hunched over in grief and hunched over a laptop. It reads the same postural signals and produces the same neurological response: elevated cortisol, sympathetic dominance, reduced immune function. So now let's talk about ergonomics, because the best intention in the world won't overcome 8 hours of poor positioning. At your desk, your monitor should be at eye level, roughly arm's length away. Your ears should be stacked over your shoulders, and then your shoulders should be stacked over your hips. Your hips should be at about a 90-degree or slightly more open. Your feet should be flat on the floor. So if you're using a laptop without an external monitor, you're basically sitting in a posture that's almost impossible to maintain correctly for an extended period of time. We would ask that you please consider a monitor riser or an external keyboard. We have a cool infographic to help you set up your desk space, so please ask for it on your next visit. When using your phone, you've probably heard the term text neck or forward head posture. So when your head drops forward to look at the phone, the effective weight on your cervical spine increases from 10 to 12 pounds to 40, 50, even 60 pounds, depending on the angle. So what you can do is bring your phone up to eye level. It feels strange, but do it anyways. Your neck will thank you. In your car, your headrest exists to prevent whiplash, but it only works if your head is actually resting on it. So if there's a gap between the back of your head and the headrest, that means your seat is probably reclined too far back. So bringing that seat back closer to vertical and letting your head make contact with the headrest will help. Your lower back should also be in contact with the seat back, so you can use a lumbar support if needed. Ergonomics isn't about perfection. It's about reducing the cumulative load on your spine during the hours when you're not being actively adjusted. Every small improvement compounds. We'll see you on your next visit. If you have any questions between now and then, our team is always just a call or text away. We've got your back every step of the way.